I'm a first semester nursing student and the time is 12:25. Today I will be performing an NG tube insertion. I've gathered my supplies. I've come into the patient room. I have identified the patient with using two patient identifiers. I've also assessed my patient for any previous nasal surgeries, gag reflex, and also the level of consciousness or the mental status of my patient. I have washed my hands. I have my patient in high Fowler's position, and I will now measure from the tip of the nose to the tip of the ear down to the xiphoid process. Once I've had that, I will remember my measurement, keeping my towel placed over the patient, and I will place tape over this area so that I know when to stop my insertion. Again, I will now wash my hands, and I will proceed to put on non-sterile gloves. I will have the patient something to drink, water, and then a bucket in case they vomit. Okay. I will have my patient hyperextend their neck. After I have lubricated the tip, about 4 inches, and then I will gently insert until I reach the oral phoenix area. At that point, I will have my patient lean forward and have them take a sip and a swallow, also rotating the tube 180 degrees. Now I will continue to insert the tubing. For every 2 to 4 inches, I will have them sip and swallow. My patient is still cooperative, and they are sipping and swallowing. Okay, I have now reached the place of my tape, so I will put a temporary tape to hold it in place. Now I would like to check to see if the tube is indeed where it needs to be. So I can do this either by aspirating the stomach contents and checking the pH and the bilirubin levels. I can get an x-ray, which is the most common, well, not common, but the most accurate way of knowing that my tube is correct. Or I can take a syringe and inject 20 to 30 mils of air into the tubing, listening over the epigastrus with my stethoscope, listening for a swooshing sound. The placement is correct. So I will now pin the tubing to the patient's gown. I will connect the tubing to the suctioning, and I will document this procedure. I will now take my tape, being sure that the patient can still breathe, and apply it over the patient's nose, on the bridge of the nose, being sure not to cover the nares.